This past week, we had the opportunity to take a tour of the new 11,000 square foot emergency department with Dr. Kubation, who is the Director of Emergency Medicine at New Milford Hospital. With patient comfort and convenience in mind, the new building features a parking lot that will allow patients and their families easier access to the building, as well as a beautiful outdoor garden where patients can enjoy fresh air and recuperate. When entering the front of the building, you will be welcomed by a lobby filled with beautiful natural light. One of the more interesting and innovative parts of this new building is the various gardens on the roof where they grow fresh and healthy food for their patients as part of the Plow to Plate program. Why a new emergency room?
So this really is state of the art, and some of the big changes here that are important to us and to our patients is these are all private rooms. So if you remember our old emergency department, we would have like big rooms with curtains separating people. Yeah. These are all private rooms. It has doors so you can close for audio privacy. It has curtains that you can close for visual privacy. And it's also nicer from the standpoint of infection control. So if someone's in the same room as you coughing, you don't have to worry about getting the germs or anything like that. So that's a big jump up in terms of the privacy and having the private rooms. The other big change here in this design is, if you remember, in the old emergency department, the doctors and nurses were all down this end, and then the rooms were all down the corridor. And we didn't get to see the patients or hear the patients. And that's important, especially if someone's really sick. So we're in the middle now. We're in these two areas here. So we see all the patients and we hear all the patients. So if someone's having difficulty breathing or coughing or they're shouting out for help, we can hear them, we can see them, and we can get to them a lot quicker. So it's a much safer design from that standpoint.
What's happening to the old emergency room?
Great question. So the architectural company that did this emergency department design here, they do what's called a master facility plan, and they're looking at that space and also all the rest of the space in the hospital, and they're trying to help us decide what's the best use of that space and all the other spaces in our hospital. One of the things that we're going to start, and we're going to start working on this within the next few months, is building a primary care medical practice inside the hospital here. It's not necessarily going to go in that space, but we might move other stuff over to free up the space that we really need. And that's going to be a primary care doctor who will be able to see patients for whatever doctor appointment they might need, and also be able to get all the testing that they need done right here at the hospital. So it's sort of one-stop shopping for medical care right here at the hospital.
What towns will be served by the new emergency room?
So our catchment area, we have 7 surrounding towns, and that includes Kent, Washington, Warren, Roxbury, Bridgewater, Sherman, and of course New Milford. But we do push out, and those are our primary service towns. We do push out into towns like Brookfield, Newtown. We do see people from Danbury, Southbury. So we do reach up into Litchfield and Torrington a little bit as well. But our primary service area is those 7 towns, and we from those towns on an annual basis we see about 18,000 patients.
Could you just explain the difference between an emergency room and a trauma center?
Sure. Trauma center is a designation, and that is assigned to an emergency department that has a certain backup capacity in the hospital, and I'll give you an example of that. A trauma center like Danbury Hospital has a neurosurgeon. So if someone's on a ladder and they fall and they crack their head open, they need to see a neurosurgeon. We don't have a neurosurgeon at New Milford Hospital, so we don't have that trauma center designation because it's that backup of the neurosurgeon that's required when you have a trauma center. We are able to handle the majority of trauma that comes our way. So car crashes that occur on Route 7, ambulance gets dispatched, the EMTs will look at that patient, they'll call us on the radio and they'll say, hey, I got a person, bumped his chest against the airbag and otherwise looks fine. I think he's fine to come to New Milford, just want to check with you. And we say, yep, sounds good, come on in, no problem. Or they'll call and they'll say, I'm in a car crash, patient smashed their head through the windshield, I out of it. They don't even know what country they're in. We think this person probably belonged at Danbury, and I'll say, sure, take them down to Danbury, and they'll go to the trauma center. So we have a very tight relationship with the ambulance folks in all the surrounding towns, and we communicate over the radio, and we decide which patients can come here, which patients need to go to a trauma center.
Is there typically a certain time of day that the emergency is most busy?
So that's a good question, and it follows sort of the cycle of a human day. So it gets very quiet here at night, and because what do humans do at night? They sleep, right?
Yeah.
And then in the morning, people tend to sleep in during the early hours, 6, 7, 8, 9, and some people like sleep until 10 or 11 o'clock. Our volume follows that normal cycle, and so by 11, 12, we really start hitting full stride because most people are awake by then. And a lot of what we see in the emergency department is injuries, so you know, there's a variability there as well. In the wintertime, everyone is sort of indoors and not doing a lot of stuff outdoors to get injured, so we don't see as much stuff in the emergency department in the wintertime as we do in the summertime when people are out riding their bikes, getting stung by bees, doing all kinds of stuff to get themselves injured. So we see variations on time of the day, day of the week. The weekends are busier, right? Because people injure themselves while they're mowing their lawn, right? But you're not mowing your lawn on Tuesday, Wednesday, Thursday because you're at work, right? You're working, you're doing that on the weekend. So time of the day of the week, and time of the year cause all kinds of variations in our emergency department. So we have to adjust our staffing and our capabilities for all of that. And it's really quite predictable. And it's very similar in all emergency departments. So we adapt to that.
What type of medical situations are appropriate for emergency?
So, you know, for people out who have no background in medicine, they don't know whether a situation is necessarily serious or not. And we see people who have very serious situations who wait at home way too long, sometimes days. And we really wish they had gotten to us earlier because, you know, they wouldn't be as sick as they are. So, and then there's sometimes the opposite. Some people might get a little bit of a cramp on the side and just come running to the emergency department. We much rather see that person than the person who's waiting too long. So what I tell people is, if something's happening that's really painful, that's a sign. Your body, it's one of the number one signs that your body can tell you, pain, something's wrong. And so that gets a lot of people to the emergency department. Certainly any problems with your breathing, and we see a lot of people with breathing problems, that will get you to the emergency department. Cuts and bleeding, I think those are kind of obvious. And in general, we see a fair amount of false alarms, but I always tell those people, I'd rather see the false alarm than you stay home and something bad happen to you. So we let people exercise their judgment. We caution people not to ignore symptoms and not to wait at home because sometimes that can have a really bad outcome.
How many patients can this ER handle at one time?
So we have that surge capacity. We can easily handle 16 patients in a comfortable environment. If we needed to surge up higher than that, we could probably go up to 20 in acute care right here. But in general, our current volume is 18,000. This is built to go up to 30,000 if we needed to. Yeah. Do you want to see a little bit more of the place here?
Yeah, definitely.
Okay. This is our medication room. So when the physician orders a medication, the physician orders it in the computer, and the computer sends a message to this machine here, and the nurse comes to this machine. She puts her finger ID right here to identify who they are, and the drawer with the medication pops open. When the nurse gets that medication, it has a barcode on it, and the nurse takes a scanner and scans that barcode to make sure she's got the correct medication. And then the patient has a barcode on their wristband, and the nurse scans the patient's barcode on his wristband to make sure that the medication matches the patient, so the right medication goes to the right patient. This is a typical room, and most of the rooms are typical rooms, so about 10 of the rooms are this same format. And the same format is the stretcher in the middle. We have a side of the room that is for the patient's family to be there with them, and we have a side of the room for the doctor, nurse, and clinical staff to be moving back and forth, which is this side of the room. We built this room that has the same basic design of the other room I just showed you, except we can turn that key there, and from the top of the wall, a metal screen comes down and covers all the equipment. So if we have somebody who has a psychiatric behavioral health emergency, we can put them in this room and keep them safe, and they don't have access to any of that equipment to get hurt on, and we can just turn this room into a safe room. This is a critical care room. So we can take care of trauma in here. We can take care of someone who has a cardiac arrest or anyone who has any serious medical problem. The reason why this is so large, patients who are in that situation require a lot of equipment. We can pull in x-ray machines in here, EKG machines in here, ventilators to help them breathe. All that equipment gets pulled in here. So it looks like this is way too much room, but when a case like that comes in, all the technology that gets pulled in here in that emergency just fills up this whole room. The design allows for us to actually bring the patient right from the ambulance. The ambulance pulls right up to that door, right into this room. So it's a really close shot to get into this room. If someone comes by ambulance, they'll come through the back of the hospital, and the ambulance pulls right underneath here and parks underneath here. They've got roof for protection from the weather. We have heating here, LED lighting, and we have plug-ins because the ambulances have a lot of equipment and their battery will die on the ambulance, so they can plug into that and keep the battery alive and the equipment going. This, again, is built with the same design, except this room, when you press this panel here, turns this room from a regular room into a negative airflow room. And what does that mean? That means that all the air in this room gets sucked out through a special filter outside of the hospital, and it doesn't allow any of the air to come into the hospital here. This has its own bathroom too, so you can take someone who has an infectious disease, like Ebola, or more commonly chickenpox or measles, and you can put them in this room, and it doesn't allow the spread of that disease into any other of the rooms or any of the patients here.
With all the changes coming our way, we are confident that this new building, combined with its phenomenal staff of expert nurses, doctors, and emergency caregivers, will allow a healthy and safe place for our community to receive life-saving care. We'd like to thank Dr. Kubation as well as other New Milford Hospital staff for allowing us to take a tour of their new emergency department.